Hi, good afternoon. Welcome on Share Care program. My name is still remain Funmilayo Makonjola. Welcome on my program. You know what we do on this program. In case of those people that see my video for the first time, it's a program where we invited different medical professionals. They will be talking on different health issues pertaining to their field. And if you are not started following me, try to do so because this program is a program that you will enjoy and very educated program. You can follow me on Facebook at Fumi Share Care and on TikTok at underscore Fumi Share Care. And today I have another beautiful guest on this program. Good afternoon.
Good afternoon.
Welcome on Share Care program.
Thank you so much.
What we do in this program is that you will greet my viewers, you will tell them your name and your profession and what you want to discuss with us on this program.
Oh, okay. Thank you so much again for having me. My name is Mokore Veronica and popularly known as Nosvi. I am a nurse midwife and I am also a women's health advocate and I run a channel just
Yes.
like yours called Health Chat with Nosvi. So basically that's what I do. And today on the show, what are we going to be talking about?
Okay. Thank you so much. Thank you so much on this program. And I know today you want to talk about this cerebral palsy.
Palsy.
Okay, because
Yeah.
I know a lot of children they've been suffering of this thing. Some people are even thinking this thing is a spiritual stuff. But I
No,
know that today many people will be knowing that this thing is apart, as in it's not spiritual,
no,
it's
it's not
something that they
spiritual.
can tackle on time. Please, I want you to just explain the cerebral palsy in case of those people that is hearing it for the first time.
Okay. Cerebral palsy is actually a group of disorders. It is not just one thing at a time. It is a group of disorders that affect most babies, right? And it is popular. Is actually caused by damage to the brain,
Okay.
either during birth or before birth, that's during conception, when the baby is still in the uterus, due to certain factors like lack of oxygen saturation to the brain, not enough oxygen entering into the brain, it can cause cerebral palsy, right? And then even after birth, during labor, it can happen when there is delay in maybe a woman was told she was going to go in for CS and there was a delay, so the obstruction in between can cause decreased oxygen to the brain, which can also cause cerebral palsy, and it can also occur after birth. It is characterized by abnormal movement. You notice that the baby cannot move, the
Cannot work.
limbs cannot walk, cannot talk, cannot feed properly. The baby is always crying. So yes, basically that's what cerebral palsy is about.
Okay. Another question I will ask you because we have to be taking it one after the other.
Oh,
The
okay.
another question is what is the causes of this cerebral palsy?
The causes of cerebral palsy can actually be divided into maternal causes and the fetal causes.
Okay.
From the mom, it can be due to lack of vaccination of the woman against rubella, right? Rubella is actually an infection that affects the mother, and if she doesn't get vaccinated against it, then when she gives birth, the baby is at risk of developing cerebral palsy. Another cause from the mother could be other forms of infection or chronic disorders that affect the mother, such as hypertension, diabetes, thyroid infections. Yes, all of these infections can actually, even preeclampsia, can affect the child in vitro. That's when the child is still in the uterus. You get, it can affect the child, decreasing oxygen to the child in the womb, and which can actually result to cerebral palsy. Then it can also be fetal when the child also has some forms of infection, right? And then some diseases like viral encephalopathy. We also have bacterial encephalopathy. That's when the membrane is actually affected and then there is decreased oxygen circulation to the brain. It can also cause cerebral palsy.
There is a lot of things in this cerebral
Yes, there
palsy.
is a
But
lot.
what are the common symptoms that if you see, you said sometimes it cannot be inside the womb when they give birth to the baby. What can now be the signs and symptoms that somebody will see that this child I think is developing this
A
cerebral
cerebral
palsy.
palsy. Okay, some common signs and symptoms actually include irritability, when the child is easily irritated and always crying,
Hmm.
always crying. That's why mothers are actually encouraged to take both prenatal care seriously and postnatal care seriously. So if you have given birth successfully and you go home with your baby, that doesn't mean that you should just go
Have
and that's
anything
the
to do
end it.
again.
Yes, you need to still come and be bringing your child to the hospital for frequent examination. And then another sign and symptom could be delay in reaching milestones, right? A child is a certain month and is supposed to start talking, but that child isn't talking. It can be a sign of
Cerebral
cerebral
palsy.
palsy. Then we have tremor. The hand is always jittering, you get. And we also have lack of muscle movement. The hand is stiff. It can affect either the upper limb or the lower limb. That's either the leg
Leg
or
or
the
hand.
hands, you get. The child is not able to move them. Then there's also intellectual disability. The child is not able to understand certain things that are due for their age properly. It could actually also be a sign of cerebral palsy.
Okay, thank you so much. There is another question I will ask you. Like,
Okay.
how can they be diagnosed on time? Like, if a pregnancy, is there any test that a pregnancy woman can be doing that somebody will know that this child that is you have inside you is this child can be developed cerebral palsy?
No, when the child is still in the uterus, cerebral palsy cannot actually be diagnosed.
Okay,
The diagnosis of cerebral palsy is actually clinical, right? The child has to be brought to the hospital and then these signs and symptoms are seen. The only test right now that can actually be done to diagnose cerebral palsy is MRI. That's magnetic resonance imaging. Once that is done, you can able to say, okay, oh, this child has cerebral
palsy.
palsy. So it's when the child is born that you can actually detect cerebral palsy. But in the uterus,
They can't
it
detect it.
cannot be diagnosed.
Okay. But what is there any treatment for them? Like if they see it on time, like they see the baby that this baby, the way we are seeing this baby is developing this cerebral palsy, is there any treatment they can do for them and it should be as if the child will be okay again?
There's actually no cure for cerebral palsy. The management is actually based on the symptoms, right? So cerebral palsy actually affects almost every part of the child. It affects physical activity, which is relating to movement. It affects their cognitive development. The child is not able to learn properly. The child cannot talk, speech disability. The child cannot swallow. So the only thing that the parents of this child can do for this child is to manage the child based off of these symptoms, meaning that it is a multidisciplinary approach. That's you bring a psychotherapist, you bring an occupational therapist, you bring another person to help with the speech. You can also bring a physiotherapist to help in helping the child try muscle movement and all of that. So basically, that's how a child with cerebral palsy can be managed, right? But there is really no treatment.
Mm.
However, it's important to note that cerebral palsy is a static disease. It is not progressive. It is not something that you say, okay, well, the child was better when he was younger, and then as the
The
child
child
is
will be
growing,
going.
then the sickness is becoming worse. No, it is actually a static disease. So you just help the child to engage in these activities that he can be able to, like, do you get, managing the symptoms, but there's really no treatment for cerebral palsy.
As a nurse now, as in which advice, as in what advice can you give those people that have these children?
Wow, a mother who is managing a child with cerebral palsy needs all of the care in the world. She needs every form of emotional support that she can get. I will advise that she gets help either from her husband or even somebody else, maybe bring
Community.
in somebody to help her, because taking care of a child with cerebral palsy can be overwhelming. If you have a healthy child who is always running around, all the stress that can come with a toddler running up and down and all of that. Then when you have to now manage a child, I know of a cerebral palsy patient, baby who is 10 years old,
Mm.
right? But she still cannot talk, she still cannot feed herself, she still cannot run, she cannot even walk,
Especially if it's
right?
a girl.
A girl, so she cannot do anything for herself. The mother basically has to do everything. So I think the number one thing is to give that woman emotional support. Her husband should be there, her parents should be there, everyone who can actually help in relieving her stress should actually be there, because she needs both emotional support and mental support, right? So that's the number one thing I will advise.
Yes.
I would say she should take care of herself properly, her mental health, her emotional health, everything. She should take care of herself properly, because mentally it can be draining. It can be draining knowing that you
Seriously,
have
I
a
can't
child who
imagine
is
it.
not
Yes.
growing. Ah, if you need to get a therapist, right? If you need to get help with therapy, I advise the woman should do that. So basically, I think what she needs is all the emotional support in the world.
Thank you so much. Seriously, I really appreciate you for coming on this program because a lot of things people will be enjoying
Yeah.
what you said now. Because a lot of us, even me, when I come from the thing, say this cerebral palsy is a spiritual
No,
something.
it's not spiritual
That's what we
anything.
believe there is a
It's not
spiritual
spiritual.
something. But thank you for coming, for enlightening us on this program. I really appreciate you for coming.
You're welcome.
Guys, thank you for watching our video. Seriously, I really appreciate you guys for supporting me in all my videos. And my advice for the parents, because it's not only mothers, even the father, they have a lot of work to do. My advice for them is to show them love. Even the community, let us show them love. These people that have these children, it's not easy for them. It's not easy to be taking care of these children. And thank you for watching my program. And don't forget to follow me again on Facebook, Fumi Share Care, and on TikTok _Fumi Share Care. Thank you. See you in my next video. Bye.